Pathogen Public Service Announcement. Elizabeth George.
Brandon Tepper, AP Biology, Period 7, Mr. Despino. Our disease is called Creutzfeldt-Jakob Disease, or CJD for short. It's considered the human form of bovine spongiform encephalopathy, or mad cow disease. It's named after the German neurologist Hans Gerhard Creutzfeldt and Alphonse Maria Jacob.
The type of pathogen that transmits CJD is called a prion. Prions are infectious agents composed of a protein in misfolded form. They do not contain nucleic acids. Prions cause CJD, a degenerative neurological disorder. Prions replicate by converting the properly folded counterparts in a host to the same misfolded structure they possess.
CJD cannot be transmitted through the air or through touching or most other forms of casual contact. However, it can be spread through contaminated transplanted brain tissue and corneas, as well as injections of contaminated growth hormone. Cases of CJD that are caused by medical procedures are known as iatrogenic cases. There are many theories about other forms of CJD and how they spread. Some think, for example, that a new variant of CJD is transmitted to humans through the consumption of contaminated beef, or beef that comes from cows with mad cow disease. However, there is no proof for this. Another theory is that CJD spreads through contaminated blood.
In the U.S., there are about 300 cases of CJD per year. It affects about 1 in every 1 million people per year worldwide. About 90% of individuals who have CJD die within 1 year. Sporadic CJD is the most common type and makes up about 85% of all cases. Countries with confirmed cases of CJD include the USA, Canada, Spain, Portugal, the United Kingdom, Italy, Japan, Saudi Arabia, Thailand, and more. Discovered in 1920, the origin of CJD is unknown, but is theorized to have come from exposure to beef from cows with mad cow disease.
Some signs and symptoms of CJD include rapidly progressive dementia, problems with muscular coordination, personality changes, impaired vision, sometimes insomnia, depression, and more. Eventually, difficulty speaking and swallowing occurs, and later on, sudden jerky movements may happen as well.
There is no single diagnostic test available for CJD. If suspected, a doctor must first rule out diseases with similar symptoms, for example, encephalitis or meningitis, by conducting a spinal tap or an EEG. The only way to confirm diagnosis is by a brain biopsy or autopsy, but both procedures are risky and don't always work. Scientists are developing a new test that is safer and easier, which examines cerebrospinal fluid to find the protein markers for the disease.
The prognosis or regular course for the disease for CJD starts at the age of 60 when it begins to develop. Classic CJD usually lasts 4 to 5 months. As time goes on, the symptoms get more severe. Eventually, people with CJD lose the ability to move and speak, and later on enter into a coma.
There is no generally accepted treatment for CJD. The disease is invariably fatal. A number of drugs have been tested, including steroids, antibiotics, and antiviral agents. None of them have worked. RNA interference and certain drugs may be able to combat the disease in the future. Drugs to reduce suffering include the following.
In terms of prevention, there are no known ways to prevent CJD. There are policies to prevent transmission of CJD for medical procedures, which include using synthetic human growth hormone, destroying surgical instruments that have been used on the brain, and more. Additionally, people who have been exposed to CJD are not allowed to donate blood or sperm, including people who have received HGH or a dura mater brain graft.
Thanks for listening. The end.